Center test prep exam-based learning. Question 1. A patient with a spinal cord injury at T1 is bradycardic and hypertensive. This is characteristic of option A, hemorrhagic shock, option B, cardiogenic shock, option C, neurogenic shock, option D, septic shock. The correct answer is option C, neurogenic shock. The loss of sympathetic innervation in neurogenic shock results in unopposed parasympathetic activity, causing vasodilation, hypotension, and bradycardia. Warm, dry skin below the level of injury is also characteristic. Question 2. A trauma patient with significant blood loss is in decompensated hemorrhagic shock. Which finding would the nurse expect to see last, as a very late sign? Option A, tachycardia. Option B, narrowed pulse pressure. Option C, hypotension. Option D, tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock in trauma, especially in young, otherwise healthy patients. Compensatory mechanisms, tachycardia, vasoconstriction, can maintain blood pressure until 30 to 40% of blood volume is lost. Question 3. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 4. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer option A, folic acid, option B, vitamin B12, option C, thiamine, option D, magnesium sulfate. The correct answer is option C, thiamine. Wernicke's encephalopathy is caused by thiamine, vitamin B1, deficiency, common in chronic alcoholics. Thiamine must be administered before or with glucose to prevent precipitating or worsening the condition. Question 5. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from option A, peptic ulcer, option B, esophageal varices, option C, hemorrhoids, option D, Malloy-Weiss tear. The correct answer is option B, esophageal varices. In a patient with cirrhosis and portal hypertension, massive, painless hematemesis is most likely from ruptured esophageal varices, a life-threatening emergency. Question 6. Hepatitis is primarily transmitted via option A, blood and body fluids, option B, fecal-oral route, option C, sexual contact, option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 7. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 8. The antidote for benzodiazepine overdose is option A, naloxone, option B, flumazenil, option C, denacetylcysteine, option D, datropin. The correct answer is option B, flumazenil. Flumazenil is a competitive benzodiazepine receptor antagonist. However, its use must be approached with caution, especially with unknown ingestions or chronic users, due to risk of seizures. Question 9. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mm Hg and in the left arm is 130/80 mm Hg. The chest X-ray shows a widened mediastinum. The nurse suspects. Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, blood pressure differential between arms, and widened mediastinum on chest X-ray is the classic presentation of a thoracic aortic dissection. Question 10. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. An upright chest X-ray, or left lateral decubitus abdominal film, is the initial screening test for free air under the diaphragm, indicating a perforated viscus. Question 11. In distributive shock, the primary pathophysiology is: option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Distributive shock, septic, anaphylactic, neurogenic, is characterized by profound vasodilation and maldistribution of blood flow, leading to a relative hypovolemia and decreased tissue perfusion despite normal or increased cardiac output. Question 12. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be: option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Some chronic CO2 retainers rely on the hypoxic drive as their primary respiratory stimulus. Oxygen therapy in these patients should be titrated carefully to maintain SpO2 between 88 to 92% to avoid blunting this drive. Question 13. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, transcutaneous pacing. The correct answer is option C, immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 14. The best method to remove a prosthetic eye in an emergency is: option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue. Question 15. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet proximal to the bite. Option D, administration of antivenom, crotalidase. The correct answer is option D, administration of antivenom, crotalidase. The definitive treatment for significant pit viper envenomation is antivenom. Outdated first aid measures, ice, incision /suction, tourniquet, can worsen tissue damage. Question 16. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, surgery on the wrong body part. Option D, an armor discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events are serious, unexpected occurrences involving death or serious physical or psychological injury, or the risk thereof. Wrong site surgery is a classic example that requires root cause analysis and reporting. Question 17. The most common cause of acute renal failure in hospitalized patients is: Option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Acute tubular necrosis, ATN, is the most common cause of intrinsic acute kidney injury, often due to prolonged hypotension or nephrotoxic agents, causing ischemia or direct tubular damage. Question 18. Fat embolism syndrome is most commonly associated with fractures of the: Option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Fat embolism syndrome occurs when fat globules from bone marrow enter the circulation, most commonly after fractures of long bones, femur, or pelvic fractures, causing respiratory distress, petechiae, and CNS changes. Question 19. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when two or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 20. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A, restrain the patient firmly. Option B, insert a bite block. Option C, maintain airway and administer benzodiazepines as ordered. Option D, obtain a stat CT scan. The correct answer is option C, maintain airway and administer benzodiazepines as ordered. The priorities during an active seizure are airway management, positioning, suctioning, oxygenation, and pharmacological termination with a benzodiazepine, for example, lorazepam. Restraints and bite blocks can cause injury. Question 21. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects: Option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. The sudden onset of the 6ps pain. Question 22. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Serotonin syndrome results from excess serotonin and presents with a classic triad of mental status changes, agitation, autonomic instability, and neuromuscular hyperactivity, hyperreflexia, clonus, rigidity. Question 23. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates: Option A, normal cellular metabolism. Option B, hypoperfusion and anaerobic metabolism. Option C, kidney failure. Option D, liver failure. The correct answer is option B, hypoperfusion and anaerobic metabolism. An elevated serum lactate, 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism, which is a key indicator of severe sepsis and septic shock. Question 24. The safe harbor provision for nurses typically refers to option A law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 25. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts, option B, pregnancy status, option C, endometriosis, option D, PID. The correct answer is option B, pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered.